healthcare heroes who we are honoring this week. And it's also because of the people of Maryland who once again stepped up and fought back. Last week, our coronavirus response team reported that their biggest takeaway from this latest surge is just how critically important it is to get a booster shot. And Maryland is one of the most vaccinated states in America. We have now administered over 11.1 million vaccines. And as of today, 95% of all Maryland adults 18 and over have gotten vaccinated, which is another amazing milestone. 82% of 12 to 17-year-olds have gotten their vaccine. And 43% of 5 to 11-year-olds in Maryland have been vaccinated. That also is one of the highest rates in the country, but it's not high enough. So we continue to encourage parents to get their school-age children vaccinated, including through our successful Real Kids public service ads. We have now administered nearly 2.1 million booster shots. And while 72% of Maryland seniors have gotten their booster, just over half of adults 18 and over have. That's a lot better, again, than the rest of the country, but it's not good enough. Now, I know that there's been a lot of confusing and conflicting federal guidance regarding booster shots. And we know from our outreach that many people have told state health officials that they just weren't sure if they needed it, or they didn't even know if they were eligible. It's really clear. Everyone age 12 and older is eligible. All of the data shows that protection does wane over time, and so no one should consider themselves fully protected unless you have gotten a booster shot. While the majority of all the hospitalizations and deaths continue to be that less than 5% of the population who are unvaccinated, the data also shows that even those who complete their primary series of COVID-19 vaccines but do not get a booster shot are twice as likely of testing positive for COVID-19 as those who are fully protected. Their risk of being hospitalized with COVID triples, and they are 3 times as likely to die from COVID-19 if they are not fully protected with a third dose. These trends apply across all age groups. It is clear that getting fully protected with a booster is the single most important thing that you can do right now to minimize the impact of COVID-19 and its variants, and to help us finally move on from this pandemic. In an effort to get more Marylanders fully protected, today we are launching a new booster action plan through our GoVax campaign. We are immediately expanding call and text-based outreach to all eligible Marylanders. To date, the GoVax Maryland team has already completed more than 2 million calls and sent over 1.9 million text messages, facilitating tens of thousands of additional booster shot appointments. We're going to ramp up that outreach considerably in the coming days. If you get a text or a call from the GoVax team, they can help you get set up with a booster appointment right away. If you're a homebound patient, or if you need help getting transportation to a clinic, they can help you with that too. Now that the demand for testing is dropping significantly at our hospital-based sites, we are also going to start offering booster shots at many of our hospital-based testing sites, with plans to continue to expand that to additional sites as needed, in addition to the 539 clinics across the state that currently offer booster shots. In addition, the Vaccine Equity Task Force has now expanded its mission to offer clinics with community partners that are focused on booster shots. And I want to again take this opportunity to encourage employers to consider offering paid leave for their employees who want to go out and get their booster shot, which is something that we have successfully done for state employees. Last year, Maryland launched one of the nation's first vaccine lotteries, which helped us achieve our vaccination goals. We saw winners from all regions of the state, including a nurse from Frederick, a retiree from Elkton, a construction worker from Annapolis, a high school teacher from Elkridge, and a school custodian from Indian Head, a grocery store worker from Towson, and a child care worker from Silver Spring. The initiative was a success, and so we then turned our efforts to getting more of our young people vaccinated against COVID-19. We launched, in partnership with the Maryland Higher Education Commission and the Maryland Department of Health, a program to provide $1 million in college scholarships for Marylanders aged 12 to 17 who got vaccinated. Again, that effort resulted in a significant increase in vaccinations. And now with more than 95% of adults vaccinated, we are focusing our efforts toward getting more Marylanders fully protected. So today we're announcing a $2 million Vax Cash 2.0 lottery for the state of Maryland from now through early May. Utilizing the same exact program we used before, the random number generator that was used for the successful Vax Cash and VaxU promotions. The Maryland Lottery will randomly pick and award one Marylander who receives a booster shot each week for 12 straight weeks. We will kick the campaign off with a special initial drawing of $500,000 1 week from today, next Tuesday. If you have already gotten the booster, or if you get it by next Monday, which is Valentine's Day, you will be eligible to win that $500,000. Weeks 2 through 11, winners will be selected for $50,000 prizes each week. And then in week 12, our grand prize winner will receive $1 million. The entry for this $2 million lottery campaign is simple. You must be 18 and older and have received all of your shots here in Maryland. That means 2 doses of Moderna and a booster, 2 doses of Pfizer and a booster, or the one-shot Johnson & Johnson vaccine and a booster shot. Those who have already been boosted in Maryland at any time are eligible for these prizes and will automatically be entered to win. If you have not yet gotten a booster, the sooner you do, the more drawings you'll be eligible for. Maryland Department of Health will notify all of the winners. All you have to do is go out and get boosted to boost your chances of winning $50,000, $500,000, or even a $1 million prize. Our goal with this promotion is to reach those people who didn't realize the importance of getting boosted, or who are on the fence, or those who just haven't gotten around to it yet. We're hoping that this lottery will reinforce the importance of getting every Marylander that we can boosted against COVID-19 so that they can be protected against this virus and its variants. As you know, we proclaimed Healthcare Heroes Appreciation Week here in Maryland. Our doctors, our nurses, all of our medical professionals and EMTs, along with the clinical staff at our testing and vaccination sites, have been under tremendous stress, caring for the tens of thousands of patients who've been hospitalized with COVID-19 and working around the clock to prevent additional deaths. And we owe a profound debt of gratitude to our frontline medical workers. Our state continues to lead the nation in health and economic recovery, and it is due in large part to their incredible dedication. In honor of Healthcare Heroes Appreciation Week, today we're launching a Healthcare Heroes poster competition in partnership with the Maryland State Department of Education. We're calling on creative students across the state from pre-K through grade 12 to submit posters which depict the theme celebrating Maryland's healthcare heroes. Winning posters will be selected at the elementary school, middle school, and high school levels. And Dr. Jinlene Chan and my favorite artist and art teacher, the First Lady, will serve as our judges. The winning posters will be displayed at area hospitals, and the winning students will be invited here to the State House to receive official governor's citations. And this Friday, we will be lighting up Government House, M&T Bank Stadium, and Oriole Park at Camden Yards, blue. And we're asking Marylanders to wear blue on Friday as a sign of our appreciation for for these incredible heroes who have sacrificed so much for us over these past 2 years. Lastly today, I want to put to rest a question that some of you have been asking me. I want to let you know that I will not be a candidate for the United States Senate. I sincerely appreciate all the people who've been encouraging me to consider it. A number of people have said that they thought I could make a difference in the Senate and be a voice of common sense and moderation. I was certainly humbled by that, and it gave me and my family reason to consider it. But as I have repeatedly said, I don't aspire to be a United States Senator, and that fact has not changed. Over the past week, as I was working on my State of the State address, it really drove it home for me even more clearly just how important it is that I finish the work that we've started together here. And when I pledged to the people of Maryland that I was going to give this job as governor everything I've got every single day that I have been given, I meant it. And that commitment is far more important to me than any political campaign. That does not mean that I plan to sit on the sidelines when it comes to the serious challenges facing our country and our democracy. I'm going to continue to call it like I see it, and I'll keep speaking out about the divisiveness and dysfunction in Washington and about fixing the broken politics. My current job as governor runs until January of 2023, and then we'll take a look and see what the future holds after that. But for now, I'm going to keep working hard over this next year, and I plan to run through the tape at the finish next January. With that, I'd be happy to take some questions.
Governor?
Yes, sir.
If I could start there, obviously with your decision not to run for the United States Senate, speculation is going to grow now that you were looking at the presidency in 2024. Can you speak to that, or at least tell us what your process for making that decision would be?
I sort of touched on that a little bit in my remarks, and I've said it before. I really want to focus the next 11 or 12 months on finishing this job. In January of 2023, I'll have plenty of time to think about what the future holds. I think the world's going to be a different place a year from now, and in the meantime, I'm not going to do a lot of thinking about that. I'm just going to continue to do what I've been doing, and that election's pretty far off. It's a couple of years away.
And if I could follow, would that decision be based upon whether or not the former president runs?
No, it wouldn't be based on that at all. It would be based on whether I think that I can make a difference and whether it's the right decision for me and my family. And, I wouldn't care whether the former president runs or not.
Governor, have you spoken with the Senate Republican leader about your decision? It's been publicized that he's been trying to get you.
Just today, I had the opportunity. I called Mitch McConnell. I talked with him. I talked to Rick Scott. I reached out to Mitt Romney and Susan Collins and a number of others and let them know of my decision. I also just spoke with Senator Van Hollen to let him know that he can rest easy and get a good night's sleep tonight. It comes from the lottery proceeds, so there are no tax dollars involved, just like the other two. Yeah.
There's 4 states that have loosened their school masking mandates this week. Are you satisfied with the pace that Maryland has set on this matter?
We lifted our mask mandate last May, so we're, 7 or 8 months ahead of those states. We don't have a mask mandate statewide, but we are having discussions with the State Board of Ed. They have said that they're going to review their mask recommendations to the local schools on a monthly basis, and we're going to ask that they do consider making some changes to that at their meeting this month. Yeah. A question, Dr. Chan.
Dr. Chan, could you summarize from some of the updated information that you've seen, how the state looks, and also with what some of the local governments could do in regards to mask mandates and other things of that nature from what you've seen?
Well, I think as the governor's alluded to, our numbers now, we saw the numbers with Omicron shoot up in the month of January. Our first case was reported in early December, but just as quickly as it came up, it came back down. Not without a lot of consequences for people being hospitalized, and unfortunately, people did die because of this wave. And so across the state, we are looking at improved numbers overall. It still is, a local jurisdiction's, prerogative to make decisions about mask mandates and other decisions to protect their residents as well, working with the state.
Governor, could you speak to how prepared the state is in the event there is another surge similar to Omicron?
I think we're about as prepared as we could possibly be. We're all hopeful that we're not going to have another Omicron situation. It was incredibly difficult to deal with. As we've all mentioned, our team has been working around the clock for nearly 2 years now, battling every one of these phases, but we can't be guaranteed that there's not another one in the future. But I think we're much more prepared than we ever were before. When COVID first hit, we weren't prepared at all. Nobody in the country was. Our hospitals weren't, the federal government was not, the states were not, and we had to build things from scratch. But now we have an amazing response. We added 6,000 surge beds at our hospitals, and we've got just an incredible, massive infrastructure for vaccines and testing, and so we're in better shape. And we're hoping it's not going to happen, but we'll be much better prepared next time.
Governor Hogan, can you speak any further about plans for the statewide hospital surge testing sites? We saw you yesterday at one, and there's not many customers these days. Do you plan to close them down or have them all morphed into vaccine centers?
Well, we're very pleased that that the emergency testing centers that we set up outside the hospitals are no longer crowded. That's the whole goal, is to put themselves out of business. We don't want long lines of people that are sick and wanting to be tested. So I'd rather not see a soul in any of those tents. But I mentioned we're going to be converting a number of them right away this week, and I think more the following, into centers that will still provide testing for folks that want it, but will also be focused on giving boosters. And we are reviewing that. We had a meeting to discuss it today. If they're not being utilized, then we'll be able to start phasing them down. But many of them, I think we're going to be able to serve dual purposes and still get some use out of those professionals that are working there. When they're done, we take them down, and that's why we have tents rather than building buildings.
Governor, there's, I think, a widespread belief that if you had run for the Senate, it would have been very competitive. Some people think you were the only chance of Republicans winning the Senate in Maryland next year. Without asking you to divulge private conversations with Senator McConnell or anybody else, was there disappointment or chagrin or anything that this opportunity would be teed up and you would make the decision you made?
I was very honest and direct with everyone throughout the entire process who's asked me about this for 2 years, including all of you and Mitch McConnell and all the folks in the Senate and friends of mine, supporters, donors. I got family members that were saying, why don't you consider running for the Senate? Every single time I've said pretty much the same thing, so it shouldn't come as a big shock. But yes, I believe we would have won the race. There were, I think, 3 different polls that showed us winning by double digits. But just because you can win a race doesn't mean that's the job you should do if your heart's not in it. And I just didn't see myself being a U.S. Senator. And I don't know. We haven't elected a senator since Mac Mathias as a Republican, I think 40-some years ago. It would be difficult for just about anyone else, I think.
Governor, your reaction to Senate Democrats holding up your appointment to the Court of Appeals and senators from your party holding up appointments to the Accountability Board that's going to oversee the implementation of Kerwin out of concerns that there's a lack of geographic diversity?
Yeah, no, I'm not concerned about that at all. I don't pay much attention to that stuff.
A question about COVID. Montgomery County has hit 85% mark of vaccinated people. The county government has extended the mask mandate until February 21st right now. We've been monitoring the situation in Virginia where Governor Youngkin has took more aggressive actions against mask mandates. In your view, what's the best approach? Is it better to let the jurisdictions make this call jurisdiction by jurisdiction, or is a statewide direction for this the better way?
Well, our position has been pretty clear for 2 years, and the law allows these duly elected local governments and school boards and county executives to make their own decisions. We've tried to provide guidance. We've certainly let them know when we thought that they were making the wrong decisions. And we've taken some statewide actions when we thought they were necessary. But at this point, you know, I think we are making recommendations to the State Board of Ed, which is also independent, but you know, folks that represent the entire state to say we think it's time to take a look. But I don't see us taking the kind of action that Governor Youngkin did, where he, you know, is involved in all kinds of lawsuits now with school boards because we don't know. I don't believe we have the authority to demand that school boards do what I say. You know, the voters elected them, but we're going to certainly weigh in when we think that they're being too aggressive.
Governor, can you speak to the customer service issues and delays in billing for Maryland Easy Pass customers? We're hearing from dozens of Marylanders every day about this.
It's a huge problem that we are trying to address, and it's really mostly not Easy Pass customers. It's the people that don't have Easy Passes that are license plate readers. It's a totally different billing system. When at the beginning of COVID, it's a strange confluence of events, but we sped up the implementation of all electronic tolling. We could not have people in the toll booths collecting during the early stages of COVID because it was a health hazard. The contractor, a brand new contractor that was taking that over, decided during COVID not to bill people, you know, to postpone billing. So they've been getting a year-long, nearly, waiver on paying their bills, and now it's very frustrating because people didn't remember all of the tolls that they incurred, and now they're getting bills. So we're taking every step possible to hire more people, to deal with the contractors, to work on getting subcontractors, to provide payment plans, to provide more leniency. But these are not, it's not a problem of people being billed for something that they don't owe. It's a problem that they didn't get billed all during COVID, and now they're just starting to get them. And we're trying to take every step possible to make that an easier transition for them. Thank you.
Thank you, Governor.
Thank you.